Good afternoon, thank you, and thank you for your patience today. As usual, we'll start off with some numbers. As of this morning, we have 15 total inpatients with COVID-19 within our system. 1 at A.R. Gould Hospital, 9 at Eastern Maine Medical Center, 1 at Inland Hospital, 3 at Mercy Hospital, and 1 at Sebasticook Valley Hospital. And in addition, we are taking care of 4 COVID-19 positive individuals through our home care and hospice team at their home. And so that's obviously a much lower number than we have been talking about for quite some time now, and that's good news, but it still comes with a word of caution. We need to continue to do the things that keep us all safe. One of those is being vaccinated, and to date, Northern Light Health has administered a total of 37,038 doses of vaccine. That's a combination of Pfizer and Moderna. This represents 26,269 first doses and 10,769 second doses. The patient and community feedback that we've been receiving around several of our vaccination sites have been largely positive. We've been able to vaccinate hundreds at each site each day, and more than 1,000 people at our vaccination site at the Cross Insurance Center in Bangor. I have a few updates to share about the Cross Insurance Center. Governor Janet Mills visited our Bangor site on Saturday for a tour and media briefing. Dr. Shaw was also on site for the second consecutive Saturday. He spent time learning more about several of the aspects of the clinic, including how we draw up vaccines prior to administering them. We're happy to share these details with the governor and Dr. Shaw, and as we know, they may be helpful for planning other mass vaccination clinics throughout the state. During the pandemic, Maine's hospitals, healthcare systems, government, and communities have done a great job working together. The spirit of collaboration will continue to be key as we look to bring the pandemic to an end. On Saturday, we opened up a second pod at the Cross Insurance Center concourse. This will allow us to vaccinate up to 3,000 to 5,000 people per day. The actual number of vaccines we'll be able to administer on any given day will continue to be determined by our vaccine supply. Yesterday's vaccination event at the Cross Insurance Center was successful. People who registered to be vaccinated had the option of rescheduling due to the weather, which did fill up our phone lines. We appreciate the community's patience as we opened up scheduling for next week's clinics while simultaneously rescheduling people who could not attend yesterday's clinic. 1,000 people got vaccinated yesterday out of a scheduled 1,600, and 1,600 are scheduled for this Thursday, though we know that some of them will have additional numbers that day due to rescheduling. I also have a few updates to share about registration. A limited number of landline users who have called our vaccine hotline to register for an appointment have been charged long-distance fees by their long-distance carrier. The number is an in-state number, but it is not a local call for some people. I'm happy to report that we have worked out a solution with the vendor, and we don't expect this to be an issue moving forward. As of last week, we updated our vaccination scheduling website times to be more flexible and offer more options. The website is open most of the time, which makes it easier for people to check to see where there are available appointments. New appointments are added every Monday and Wednesday at 2 p.m. We continue to listen to feedback and to make updates to the site and make it as easy to use as possible. The limiting factor for us continues to be vaccine supply. Finally, we continue to receive questions about why we cannot vaccinate community members who are younger than the age of 70, those with chronic conditions, and others. We follow the Maine CDC direction on who to vaccinate. Currently, we remain in Phase 1B, and only Mainers 70 years of age or older, certain healthcare workers, and a limited number of other frontline workers qualify. Please continue to monitor the Maine CDC website for the latest on their phased approach to vaccination. And with that, we'll open it up for questions.
Okay, Brian Sullivan from WABI here. Dr. Jarvis, I would start by asking, as the weather gets a little warmer, can you tell us about what you think or Northern Light's role might be in vaccinating or having clinics in more rural parts of the state, and maybe what is that possible based on what the Cross Center offers, and do you need infrastructure like that?
So we already do offer vaccination in some of our more rural counties, particularly Aroostook County, where A.R. Gould has been leading the way in getting vaccinated. In fact, A.R. Gould as a population actually has a greater percentage of their population over age 70 vaccinated than most of our other counties. And similarly, our other facilities across the state have been vaccinated already. We do know that there are some rural counties who not only do not have Northern Light Health enterprises nearby, but have limited resources, and we will continue to work with the state in any way and capacity that we can to assist in that. We do have some ideas as to how we can reach out to more rural communities, but our home care and hospice agencies have been doing that as well, even in counties where we don't have a physical presence, and I think that's helped out tremendously. I don't think that the issue about warmer weather is a concern for us. As we showed yesterday, Mainers are hardy, and they will get out in numbers as need be. And so people safely did make it to the Cross Center yesterday. While we had anticipated about 1,600 individuals, we did vaccinate 1,000, and that just shows that weather will not deter us from this very important work.
Yeah, I guess maybe what I should have been a little more specific. As it does get warmer, do you need the building that is provided? Could you say go to a fairgrounds and have maybe on a Saturday a specific location where if there's not an AR Gould, you could have something like that where you're offering it to people in that particular rural area?
So Brian, right now we are really focused in on the sites that we have already established and expanding out in areas that need us due to population density. And so we don't have any plans like that going forward. I will say that the Cross Insurance Center, we expect to be there at least into summertime. We think that is a good location. It does provide people easy access to the highway, ample parking. And as we have shown, we can be incredibly efficient within that building. And so I know I get asked all the time about why we're not doing drive-through or drive-up vaccination clinics. But we see around the state, those are often closed due to inclement weather. Even if it's just raining, that puts the staff at risk that have to be outside to administer those. We don't have that problem with Cross Insurance Center. And we don't have that problem with any of our other facilities either. And so I think we're going to stay the course for now.
Yes, hi. Thanks for taking our questions today. This is Joe Lawler with the Press Herald. My question is essentially, are you seeing with the case numbers going down and hospitalizations going down, do you think the vaccination program is already having an impact on those case numbers, or you think that's unrelated to why the numbers are going down?
So I don't think that we're seeing, I'm sorry about that. I think there was somebody that needs to unmute. I don't think that there's really a good correlation between the amount of vaccines that we have dispensed and the numbers going down. It's too early to tell that, but frankly, we have not vaccinated enough individuals to see enough of an impact on a whole community or certainly a whole state. And so right now, I think it really is that because the weather has turned colder, people have been staying home, they have been doing the things that they were supposed to be doing, that has helped us. We do know that when we had travel around the Thanksgiving holiday, that hurt the northern part of the state. Travel around Christmas and New Year's hurt the southern part of the state, so we are still concerned about travel. And we're also concerned about the variants that we see around the state, around the country and around the world, some of which are much more infectious, so spread more easily from person to person. And so we do remain concerned, and that's the reason why we need to remain vigilant. This is not a time to let your guard down. This is actually the time to step up our efforts from a protective standpoint, wearing our face coverings out in public, remaining physically distanced from one another, not gathering in large numbers outside our own household, and washing our hands frequently.
Okay, thank you. And my follow-up question is, when do you expect the vaccines will have an impact on case counts and hospitalizations and so forth? Is there any projection for when it might start being a factor?
So when we talk about population health and we talk about large impacts due to vaccinations, we know that at a bare minimum, you need to have about 50% of a particular population to be vaccinated for you to start seeing that spread beyond the individual who was vaccinated in terms of protecting everyone else. The estimates for these particular vaccines, and because coronaviruses are so readily spread from respiratory droplets, that we really need to approach at least 65, maybe 75% or 80% of the population to be vaccinated for it to have the strongest effect in protecting those who either cannot or will not be vaccinated. And so that's really what we're talking about. And of course, we are a long ways away from that, with only about 250,000 Mainers being vaccinated to date.
Okay, thank you very much for those questions, Joe. We're going to move on now to Leslie from Penobscot Bay Press.
Sorry, I had to unmute. Thanks, Dr. Jarvis. I just
No
have a
worries.
quick question. Do you have any plans to vaccinate people at clinics in Castine or Stonington where you have facilities?
So at this time we do not, but we do know that as newer vaccines come available to us, particularly the Johnson & Johnson and the Novavax vaccines, that it seems like those are ones that are more readily available to be able to be given in say, a private practice or a physician practice office. And so at that time, we may consider that we will roll out vaccine to our offices as well as continue our large vaccination clinics with both Pfizer and Moderna. So it really just remains to be seen as to when that emergency use authorization happens, particularly with Johnson & Johnson, and then what they can actually produce in a meaningful time frame that we can start getting people administered with that new vaccine. My best guess is we won't see Johnson & Johnson in significant numbers until sometime late March. If that happens sooner than that, we will be delighted to have yet another tool to help fight this pandemic.
Oh, I'm sorry, Leslie. Let me work on unmuting you. Can you unmute yourself?
Uh-huh.
Okay, go
We
for
can
it.
hear you.
Oh, yeah, I didn't have a follow-up question, sorry.
Thank you, Leslie.
Oh, okay. Very good. Thank you, Leslie. We're going to move on next to Charlie Hacker from Maine Public.
Yeah, hey, Dr. Jarvis and Paul. Apologies, there's some background noise that might carry over. So my first question is about the when the state rolls out its vaccine registration system, whenever that happens, are you anticipating any challenges just for sort of meshing your systems with the state one, and can you offer any detail on that?
So I'm going to say I always anticipate challenges no matter what it is that we're doing. It has nothing to do with the state or technology. And I think that's really been the credit to the success that we've had with our vaccination program thus far, is that we anticipated challenges and hopefully avoided some because of that. Anytime we introduce a new technology, that's going to cause some challenges. Especially if there has to be an interface between one system and another system. We have been working with the state on choosing and selecting a platform as well as giving them guidance on what we can and cannot do from an interface system. We'll just have to wait and see what the final decision is as to what the state is building up. We welcome anything that makes it easier for people to register for a vaccine. We would welcome that news, but at this time it's a little too early to tell.
Okay.
Charlie?
Yep, and then my second question is about a really different subject. I've heard anecdotally, and I think there's, data out there about how the effect that the COVID pandemic has had on people's ability to get various types of mental health services and people maybe ending up more in the ER because they're not getting more outpatient type treatment. Have you been aware of any of those sorts of trends at Northern Lights hospitals, and can you offer any detail on that?
So Charlie, I can't give any specifics on that, but I will say it is a challenging time for those who have mental health and behavioral issues. Just like it's a challenging time for everybody else, but it's magnified in that particular population. We continue to do outreach. We continue to provide telehealth services. Acadia Hospital has led the way in telehealth services for psychiatric and mental health issues, and we continue to do that. We have made a commitment that for our practices, we will have 30% of our visits done by telehealth, regardless of what the specialty is or primary care. And so we will continue to work on avenues that we can provide outreach. But that does not help alleviate the anxiety and stress that all of us are under, particularly those who suffer from mental illness. We have seen an increase at times into our emergency departments, and we continue to monitor that on a daily basis and see what we can do working with our partners across the state, as well as our own agencies like the Acadia Hospital to assist that population. Thank you for that important question. It's an important population that oftentimes gets overlooked, and we need to continue to focus in on them and make sure they're getting the care they receive.
Okay, thank you very much for those questions. Charlie, now we're going to move on to TV7, and that's going to be Stephanie Wittenbach. Stephanie, I understand you said you're having some issues unmuting. Try now. You should be able to unmute now. Stephanie, try unmuting yourself now. You should be able to ask a question and unmute.
If she is not able to unmute, I can ask her question for her.
Oh, do you have her? Okay, you have her question?
I do
Karen?
have her question. Yeah, it is, when can we start to see younger people get vaccinated?
It's an excellent question, Stephanie. We don't have a time frame on that. Right now, the state is focused in on trying to vaccinate as many of our population that are age 70 and over. When we get to a point where we feel we have vaccinated the majority of those who want to be vaccinated, I believe it is the state's plan to move then to 65 and older. But that is just my opinion at this point. Continuing to work with the state and provide guidance from what we see here on the ground. But I don't think that's going to happen before the first or second week of March.
And does Stephanie have a follow-up question that you know of, Karen?
I don't see a follow-up question. No.
Okay, Stephanie, if you have a follow-up question, just make sure to send it in the chat, and we'll make sure to get that for you as well. So for now, we'll move on to News Center Maine, and that is Bob Evans.
Good afternoon.
Hi, Bob. How are you?
I'm doing well, thank you. As you mentioned, the community vaccination site was toured this past weekend by the governor and for the second time by Dr. Shaw. I know they said they were impressed with how well the operation was working, but after those visits, was anything suggested by either one of them that you might be considering as a change or a tweak in the operation there?
Bob, that's a great question. In fact, just the opposite happened. They actually asked our assistance in helping set up some of the guidance and plans that the state has for other locations, and we're very proud of that fact. We put a lot of hard work and time. There are hundreds of people who work to make that center become as smooth and as operational as it has been. And so we're actually helping others to replicate that same approach across the state.
And as a follow-up, Dr. Shaw said he specifically came back to study and learn about the pharmacy side of the operation there at the Cross Center. Now that you are ramping up the amount of vaccines to be given there, what still needs to be done to get to the maximum number of doses given per day?
To tell you the truth, right now the only thing that needs to be done is to have more vaccine. Staffing continues to be an issue and a concern for us. Most of the people that are working there are volunteering their time and efforts to be there, and we know that that can wear on people for the long run. And this is a marathon, not a sprint. And so we do continue to monitor for staffing issues and working very well with that, and Paul might have some comments about that after I'm done. But truthfully, we put the infrastructure in place from day one that we would be able to vaccinate up to 5,000 people a day. And if you think about it, that's going to happen if we start vaccinating as many as 2,000 people a day with first doses. Eventually, they will need to come back for their second dose, which means we'll be vaccinating 4,000 people a day just with those two numbers alone. And so we did build that into the process. As I stated before, on Saturday, we did open up the second side of the concourse on the Cross Insurance Center, or what we call Vaccine Pod 2. And we expect that we will need to use that going forward as we're starting to see an increase in the amount of vaccine coming to us and the increase in the number of people we're vaccinating. So we built this with the goal in place of always being able to do 5,000 people a day. Paul, do you have any comments on staffing?
Sure, thanks, Dr. Jarvis. So we certainly couldn't staff this Cross Insurance Center vaccination clinic without the community's support through community volunteers, as well as our own staff for being part of this important process. So it's a collaborative effort with community members as well as healthcare workers. We want to make sure that our healthcare workers are doing the things that only they can do. And so things such as wayfinding and other support, assistance with ambulating or pushing people in wheelchairs, et cetera, are all very important pieces of our clinic, and we're finding our community members are stepping up to the plate and helping us in that effort in large numbers, and we're very pleased and hope that that continues.
Okay, thank you very much. And a good note, I should have pointed out at the beginning of this, and I was remiss in doing that. Many of you may know this, but certainly if you have any questions medically related or operationally in terms of the COVID response, it's Dr. Jarvis. But, in terms of staffing, employee issues, or even volunteers, Paul Boland is your man. So for those going forward, if you have any questions, just let us know who you'd like that question directed to based on that criteria. So next up, we've got David Marino from Bangor Daily News.
Thanks so much. This question is for Dr. Jarvis. What was your reaction to to Maine's vaccine efficient and full use policy released yesterday that governs the administration of vaccines at the end of the day and could give vaccines to those 65 to 70 or 65 to 69 rather? The state is discouraging pre-registration lists for these vaccines. So how would the Cross Center, any Northern Light Health vaccine site, get people in this age group to get these vaccines at the end of the day?
So again, I can only speak for Northern Light Health. I can't speak for our other health systems, though I think all health systems across the state are doing a very good job in getting the appropriate people vaccinated. I'll tell you that one of the reasons why Dr. Shaw came back for the second visit at the Cross Insurance Center, specifically to look how our pharmacy aspect of things work for the vaccine, was really to address this issue. So we actually have a process where, one, we don't make appointments unless we have vaccine available to somebody. So I want people to understand that once they've scheduled an appointment, there is vaccine for them. They don't have to show up early. They don't have to worry about us running out like we see in other states. We have the vaccine if we make an appointment for you. Many times the reason why we have vaccine at the end of the day is simply because of that issue with both the Pfizer and the Moderna, that these are multi-use vials. And so for Pfizer, we often can get that 6th dose out. And for Moderna, we can often 7th or 12th or sometimes even a 13th dose out. And that's where we may have some at the end of the day. But really, by the time we are about an hour away from closing our clinics, we are down to drawing up vaccine as people walk through the line. And so we do not anticipate that we will have extra vaccine at the end of the day left over. So that's the reason why we don't have a so-called set call down line or a pre-registration for that. It's also why we're asking the general population not to hang around outside our clinic sites so expecting that there'll be vaccine to give out, because that's just not the case. Just yesterday at the Cross Insurance Center, despite the weather, despite the issues, we had 1 dose at the end of the day, and we were able to fulfill that, to administer that dose simply by having a volunteer at the site who was willing to get their vaccine and who met the criteria of either being over age 70 or being a healthcare worker. And so that's really what we have been focused in on. If we did find that we were miscalculating in any way, shape, or form, we would find a way to get vaccine distributed appropriately. But we have not found that to be an issue at any of our sites, where we are very meticulous. And again, this is one of the reasons why right now we support the administration of the vaccines at clinics like the one that we built at Cross Insurance Center and the smaller ones we have around the rest of our Northern Light hospitals, because we can manage those doses so appropriately that we're not wasting any vaccine.
Great, thanks for clarifying that. I did have one more question. You had mentioned that now with this new pod at the Cross Insurance Center, 3,000 to 5,000 people a day have the potential to be vaccinated. I just wanted to ask, I thought that last week you had said that now the potential is up to 3,000, but you're saying right now at the current capacity, if you had the vaccine, you could do 5,000 a day?
Correct. I think when we were talking last week is because we had not yet stood up Pod 2, nor did we have efficient staffing to go along with that, but we do now. And we have shown that there have been several times over the last week where we have approached that 440 patients being vaccinated in an hour, and that's what we would have to do to reach that 5,000 mark. It is quite common for us to be vaccinating over 200 people an hour in the facility right now as things stand, and that puts us right around that 2,000 to 3,000 per day mark. And like I said, we have reached 400 an hour, so we know that we can hit that 5,000 mark if we had to.
Thank you very much for those questions, David. Now we're going to go to Kevin Fowler from News 8 WMPW. Kevin, when you're ready on yourself, go for it.
Hi, Dr. Jarvis. I have 2 questions. The first one is, we at the station have been getting some emails from folks who have pre-existing health conditions that put them at greater risk from COVID-19. And while they are not eligible now, they are wondering if they will need to provide any sort of documentation for vaccine signups when that time does come.
So I can't comment on that because I just don't know what the requirements will be from the state of Maine. I will say that we are concerned about things such as fraud. We have had individuals who have falsified their birth date, and we do not want that to happen. This is one of those things where we talk about this is a population, moral, and public outreach that we're talking about now. So we ask people to be honest, remain honest in their answers to things. We want to make sure that the vaccine that's distributed to Maine that's intended for residents of Maine stays in those categories. But ultimately, we will follow the state's guidance, and what the state asks us to do is what we will follow.
And do you have a follow-up question, Kevin?
Yes, I do. Thanks. The follow-up is Northern Light Health asking for those getting the vaccine to share their race or ethnicity either at signups or at the time of vaccination?
So we do ask that question when we ask people to register for us, so that during the registration process, that is one of the questions that we do ask. There are some reasons why we do that. It helps us to make sure that we are vaccinating all populations and that we are doing so in an equitable fashion. But that particular field is not a mandatory field, and so if people feel uncomfortable or unwilling to fill that out, that's okay. But we do ask that because it is important for us. We want to make sure that we're reaching all communities in Maine, and that having that demographic data assists us. It is not used for any other purpose than to just ensure that we are vaccinating in an equitable fashion. Thank you for that question.
Thank you, Kevin. I'm going to move on to another Kevin now. This is Kevin Miller from Portland Press Herald. If you have a question, Kevin, unmute yourself and feel free to ask.
Actually, I'm all set since Joe was on there already, and you answered my question about the 4,000 to 5,000 vaccines. So thanks.
Oh, great. Okay, great. I do have one more question in the text box here. It looks like Dr. Jarvis, probably for you, from Brian Sullivan. Has success at the Cross Center resulted in more vaccine allocation from the state? And what are the numbers for the next shipments availability for signups?
I can't comment as to how the state makes their allocation determination. I will say that we have seen an increase in the amount of vaccine being supplied to Eastern Maine Medical Center, which is the vaccine that we use for the Cross Insurance Center. The freezer is on site at EMMC, not at the Cross Insurance Center. So we have seen a significant increase in those allocations. Whether that coincides with our success or not, that you'll have to ask Dr. Shaw and the Maine CDC about that. But it is looking good. For next week alone, we've increased from 3 days a week to 4 days. So for next week, we will be vaccinating on Tuesday, Wednesday, Thursday, and Saturday. We have a very large clinic this Thursday and Saturday, and so we're delighted that we're able to help our community and fellow Mainers in this way to fight the pandemic. So thank you for that.
And one other question, Dr. Jarvis, was where is the new pod, the second pod, located?
So if you know the Cross Insurance Center and you walk in through the main entrance of the Cross Insurance Center, Vaccine Pod 1 is right there as you walk through the door. You can't see it because we put a privacy curtain up. The second pod is actually down the hall from that. For those who have visited and seen our video, it is actually adjacent to the area that we call check-in. So all of the individuals being vaccinated go down into the check-in area, and then we determine which pod is open for them to get their vaccine, whether that be pod 1 or pod 2. And then there's a separate observation area for those that go to pod 2. It's actually, again, a very efficient way. It keeps people from crossing in front of one another, and keeps people safe and keeps the line moving. We're very proud of the work of all the individuals that helped to put that in place.
All right, thank you very much to our members of the media. For attending this virtual press conference. I think that is going to wrap up the questions, as I don't see any others in the text window right now. Again, a reminder for those of you who attended, if you would like a Dropbox links to a higher quality video than what you can record on Zoom, just let us know in the chat box before you hop out of this press conference. And thank you so much for your time.
Thank you, everyone.